Alright everybody, in this pre-lab video we are going to go over how to ventilate a patient who is either not breathing or not breathing effectively, whether that's too slow or too fast. So first thing we need to do is we need to check our patient's breathing and pulse. So for at least 5 seconds, no more than 10 seconds. Okay, our patient is not breathing but has a pulse. So from the time we have determined that they are not breathing, we have 30 seconds to deliver our first breath. So in that time, we need to assemble our equipment and be sure we have the correct equipment. So the first thing we need to do is make sure we grab the correct size BVM. So here I have an adult mask, and in this hand, I have a neonate mask. Obviously, we need to make sure that for our patient, we use the adult mask, not the neonate mask. Then we also need to be sure that we have an adult bag. So I'm going to go over the parts of the bag valve mask with you real quick. So here, this is what our mask actually attaches to. On the top here, we have a pressure valve to make sure that we are not squeezing the bag too hard as we're ventilating our patient. We want to stay in the green zone, generally between the 5 and 10 mark. This is the actual bag itself, so this is the part that we will squeeze to actually deliver the oxygen to our patient. And then just like your nasal cannula non-rebreather, you have the tubing that we will hook to our oxygen source to actually deliver oxygen. Now if you have another person, in the time where you're getting this out and ready, they can either place an NPA or OPA, but we don't want to delay ventilating our patient to actually place the NPA or OPA. We want to start ventilating as soon as possible. So what we're going to do is, first we're going to place our mask correctly on our patient's face. So the base of the mask here goes between their lower lip and their chin. Then you're just going to settle this onto their face so that the upper part here goes over their nose. Once that's in place, now we need to grip the mask appropriately. So we're going to do what's called the EC clamp. So with my forefinger and my thumb, I make a C. With my other 3 fingers, I make an E. With the C, I'm actually going to hold the mask itself. And with the E, I'm going to grab his lower jaw, and I'm actually going to pull his jaw up into the mask. You don't want to squish the mask onto their face because that's just going to occlude their airway, make it harder to ventilate. So you're actually going to pull their face up into their mask. Next, we'll attach our mask to the bag itself, and then we'll start ventilating. So slowly, over about 1 second, I'm going to squeeze the bag. And we squeeze the bag until we see chest rise and fall on our patient. Once you see the chest rise, stop squeezing the bag and let the chest fall. If you keep squeezing the bag after chest rise has started, all that extra air will go down into their stomach. Fill their stomach with enough air, and it's all going to come back up, including whatever they last ate, and we don't want that. So over 1 second, nice gentle squeeze, chest rise, release the bag, air will passively come back out. Now we're going to give 1 breath every 6 seconds for a minute rate of 10. So 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. And we're just going to keep doing that over and over again, either until our patient starts breathing effectively on their own, or someone arrives to take over for us who can bag for you so you can do something else. Now once we've given some breaths to our patient, and I'm sure that they've gotten some oxygen flowing, now I can take the time real quick, if I'm by myself, to measure and place my OPA. If I've still got time in that 30 seconds, hook it up to oxygen. So we're going to set our flow setting to 15 liters per minute. Hook our bag up. You'll notice that the reservoir bag is slowly filling with air. Once that's full of air, every breath that we give is 100% oxygen. So the bag's not actually filling with air, it's filling with oxygen from our oxygen source. So now that bag is full. Every breath I deliver to them is 100% oxygen. And then just keep bagging until your patient has a change. And then every 2 minutes, we should recheck pulse and breathing. No less than 5, but no more than 10 seconds. If they're breathing effectively, you can stop bagging. If they're still not breathing, but they have a pulse, just keep rescue breathing. If they have lost their pulse, then we should start compressions to go along with our breaths.